great to have you today in interview session after your fantastic achievement. So I bring in all the wishes and greetings on behalf of all the faculty members of SPEED Medical Institute to Dr. Shaik Mahin for scoring rank number 53 in DM Medical Group in NEET SS session 2023. Congratulations and best wishes to you.
Thank you, sir. Thank you for having me in this platform.
Great to have you. And can we know how you have started your career? Can you tell us something on yourself from where you started till date, what all you have done?
Yes, sir. I actually did my MBBS from Osmania Medical College, Hyderabad, sir, and MD Pediatrics in Osmania Medical College, Nilofer Hospital, sir. And then I wanted to pursue super specialty in adult. So I gave the medicine exam, medical group. So this is the...
So you want to migrate from pediatric to adult?
Yes, sir. Actually, the thing was that I did not want to get restricted in a limited thing, sir, in pediatric super specialty. So I thought I could practice in adult and I could see the pediatric cases also along with that. After doing adult super specialty, I could do a fellowship in pediatric this thing, and I can practice both the adult and pediatric super specialty.
Excellent. Very true. And now, how did you do it? Because for adult medicine, you have to read medical group. And how you did it from Nelson and all your pediatric stuff, and to read all this again? How, and that to top rank? How is it possible?
Means actually first first 20 months it was very difficult, sir. In the residency, it was a COVID period. We did not have any juniors. After 20 months, I thought first about the super specialty. I decided to take adult. Then I thought first I had to clear the pediatrics part for my MD, and and also in wards I would see the cases. So whatever cases I was seeing, I read the pediatric cases, and the academics in my hospital, Nilofer Hospital, is very good, sir. So I was able to clear the pediatrics in 6 months, reading through the Nelson and systemic pediatrics, whatever was there, and general pediatrics. I completed that in 6 months, and after in final year, I started with medicine. First, I went through the basic concepts, sir, whatever was there. It is means I did not think as medicine and pediatrics as different. Means the spectrum of diseases actually vary. I saw medicine as a cardiology, neurology, all those subspecialties, and even in pediatrics also, systemic pediatrics, I saw all those as cardiology, neurology, and rheumatology, everything as subspecialties. In it's not totally different, sir. In cardiology, in pediatrics, we have cardiomyopathies and arrhythmias, and whereas in adult spectrum, it's totally different. Like MI, most of them are myocardial infarction, arrhythmias, VTVF, AF, and all. And also in rheumatology, in pediatrics, we have JIA and juvenile idiopathic arthritis, inflammatory myopathies, juvenile dermatomyositis, like that. We have spectrum of disorders. In adults, it goes on to SLE, sarcoidosis, and all. So even pediatric SLE is also there. So I was just adding up upon the pediatric. I was adding what extra has to be read in adult. It was not like I was not seeing as totally different, because if I would have seen like that, it would have been very difficult for me to read both this thing.
I understand. So you looked that way, but how you studied, na, that is very, I mean, you have looked, it was very good, that was very positive. But to go through the text and the theory and all that, how it was possible?
Means Harrison was not totally a new book for me, sir. Harrison I had read even in my MBBS for 2 years, in my third year and final year. And I only read, revised the Harrison and gave my final year exam also. But that level of reading and at this time, the level of reading definitely varies. But it was what was advantage for me that this Harrison is not totally a new book for me. I started that I have read before. I could read, and I did not go through everything line by line, sir, in Harrison. Only selected topics I had chose, like a neurology, stroke, dementia, and endocrinology, some topics, and cardiology, some topics, and nephrology like polycystic kidney disease and CKD, AKA, and important tables and flowcharts of Harrison, which was there, from where questions were expected. And while doing MCQs in my later part of period, I was seeing that some questions were repeatedly coming from some tables and flowcharts. So I first got through the concept through the videos, and then I went through the charts and I revised them again and again. Totally reading a book, totally reading everything is not possible. So I just remained focused what was important and what was to be read and what will come in exam. I tried to read those.
So how many questions did you attend this exam?
I attempted 147 questions, sir.
Very good. 147 seems to be a lucky number. So now, how did you use the Speed app for your preparation?
I had used the specialty videos, sir. Gastro part videos was very excellent, sir. Those videos I understood the concepts very well, and what sir thought, everything was coming as questions, sir. And even Rumat also, I found it very easy, sir. It was like I could finish in 1-2 days of Rumat after seeing those videos. It was very well thought, sir. Those videos. And gastro, rheumat, and endocrine, I had gone through the speed videos, sir. Not all the videos. Critical care medicine, which topics, means even shock guidelines in pediatrics is somewhat different from adults, sir. But only through a minor this thing. So what extra was there, I built upon those things, sir. Like shock, hypertension, and all whatever guidelines. Polycystic, some common topics were there, sir. Like in neurology, we have seizures, epilepsy, syndromes, and all. Those I read from pediatric only. I didn't touch again in adult. And polycystic kidney disease, genetics, whatever was related, I read only in pediatrics only. I did not, those repeat topics I didn't see again in adult. And dermatomyositis and all like that.
And cardiology, what did you do?
Cardiology was actually difficult for me, sir, before. But what I thought was some topics which were not there in pediatrics, I worked hard on them, sir. Again and again, I tried to go through those topics, and ECGs and all. I tried to see whatever there were ECGs were there in the Harrison also. I tried to go through them, and even before the exam, I had gone through the ECGs, sir. Because last year there was around 6 to 7 questions and all. Means first I had gone through the recall videos and saw what topics were important. I didn't want to go through all the textbooks. So what topics were important, I went and I went deep into it.
Good. So what is the message that you want to give to the students from pediatric group aspiring for adult clinical medicine in DM?
Means it requires a lot of hard work, sir, and along with hard work, even strategy matters. Means in this, if we want to go into adult medicine part, we should at least give a thorough 6 to 8 months preparation would be needed, sir, for that. And only we should subdivide the topics at micro level and then go through the topics rather than thinking just like it's a medicine and different from a pediatric perspective. And after reading adult also, it gave me a different perspective in seeing the pediatric cases also, sir. Even clinically and this thing, I could diagnose cases also very well after going through both the spectrum.
So time to thank whom all you want to thank who built your career till date.
I would thank my parents, sir, my all the faculty in Speed, and my friends, sir, for what I am today.
So your interest is in cardiology, am I right?
My interest is in means I have to decide, sir. I'm doubtful in yes, sir. I have to discuss with the faculty. First, I came as neurology. I wanted to pursue adult neurology and take a pediatric fellowship in that. But I have to once think about the specialty.
Great. So we once again congratulate you. Wish you all the best and all the success for whatever DM super specialty you're going to take, and advance wishes to you so that you could take your dream branch and also do well, and patients will be definitely benefited out of your services. All the best to you, doctor.
Thank you. Thank you for this.
All the best. Yeah.